Welcome to the RSNA 2023 Imaging AI in Practice demonstration. My name is Albert Zhao, and I'm a third-year resident at Brigham and Women's Hospital in Boston.
Hi, my name is Madhavi Devuri, and I'm a radiology resident at the University of California, San Francisco.
This clinical scenario is entitled Trauma to Lung and Thyroid Nodules. Thank you for watching our presentation. We will walk you through the clinical scenario of a patient who presents to the emergency room after a fall. For the purposes of this demonstration, the images may not line up perfectly because they are actually different patients. Let's set the clinical scenario for this situation. Frank is a 65-year-old male who presents to the local ED having fallen during a mountain biking accident. The ED triage nurse notices right-sided chest pain and an X-ray is ordered. Chest X-ray is acquired and the image is sent to the Laurel Bridge Compass Workflow Manager, the AI orchestrator, which sends the study to VISHED 7 PACS for storage and Fovea AI Cockpit for viewing by the radiologist. Laurel Bridge Compass, as the AI orchestrator, acts as a central controller that ensures studies are sent to the appropriate AI models for analysis. In this case, the X-ray is routed to VISHED 7 PACS for viewing by the radiologist and the MilView Smart Chest algorithm. MilView Smart Chest is a radiologic computer-assisted detection, triage, and notification software that analyzes chest X-ray images for presence of suspected fracture, dislocation, pneumothorax, pleural effusion, lung nodules, lung opacities, and the cardiothoracic index. Fovea Xstream AI Cockpit allows the radiologist to view, modify, accept, or reject the Smart Chest created annotations, all while having the ability to view the original image in our VISHED 7 PACS. The Smart Chest algorithm annotates the suspected abnormalities on a copy of the image using a standard known as DICOM Structured Report, or SR. Note the paradigm here. In this case, the radiologist can modify AI results before they get into the final report, if they choose to do so at all. With DICOM SR, you can move through the lesions individually and accept or reject each lesion. In contrast with DICOM SC, or secondary capture, you see a static view with the annotations and probabilities for each labeled observation, and the radiologist would not be able to edit this in the final DICOM series of images seen on PACS.
The MilView Smart Chest algorithm functions as a companion to the radiologist's primary interpretation. Therefore, for this AI solution, the radiologist is expected to interpret the radiograph independently first and then use the AI results to confirm or augment that interpretation. Let's take a look at the results of the MilView algorithm for this chest radiograph. The algorithm identified a pneumothorax, pleural effusion, and a right-sided clavicle fracture. The radiologist can confirm that all these results are valid. Note that you can still review all the findings that the model looked at by clicking the negative tab. These results are sent back to Laurel Bridge Compass, the AI orchestrator, which sends them to the VISHED 7 PACS. The radiologist can then dictate the report. The clinical team receives information about the report and subsequently inserts a chest tube. Frank initially improves and the chest tube is removed, but then he develops shortness of breath and hypoxia prior to discharge. Given his clinical condition, the team orders a chest CT with the pulmonary embolism protocol. The CT exam is performed, and as before, the Laurel Bridge Compass AI orchestrator sends images to the VISHED 7 PACS for storage, the Fovea AI Cockpit for viewing the AI results, and to the Siemens Healthineers AI RAD companion for analyzing the CT. AI results from Siemens are sent and viewed in the Fovea AI Cockpit viewer. In Frank's case, the Siemens Healthineers AI RAD companion detects a pulmonary embolism. For the pulmonary embolism, there is a heat map that shows different probabilities of PE. For example, if we see red in the right interlobar artery, which suggests high probability of pulmonary embolism. There are also some incidental findings. For example, we see different measurements on the aorta, from the sinuses of Valsalva to the descending thoracic aorta. There are several measurements. Each section of the aorta that exceeds a threshold that you set, for example, 40 millimeters, is flagged. So in this way, we can see that there is a section of the aorta that is enlarged, and we note that as a potential ascending aortic aneurysm. Other incidental findings include finding a pulmonary nodule. So several pulmonary nodules have been identified by the Siemens Healthineers AI RAD companion. We can go through each of these pulmonary nodules that have been detected and decide whether they are true pulmonary nodules or whether they're atelectasis or calcified granulomas. Note that all the descriptors that describe these pulmonary nodules, including size, shape, margins, all follow terminology from RADLEX, a standard lexicon for describing radiology findings. Additionally, as we're scrolling through the rest of the CT, the radiologist independently detects a thyroid nodule greater than 15 millimeters. Let's keep this in mind for later. Now that we have modified, accepted, or rejected the Siemens-created annotations in the Fovea Extreme AI Cockpit Viewer, the results are sent back to the Laurel Bridge Compass, the AI orchestrator, which sends them to the Visage 7 PACS. Laurel Bridge Compass Workflow Manager, the AI orchestrator in this demo, automatically creates and pushes a report to Abadox for each AI analysis result. In this case, Laurel Bridge Compass extracts relevant findings on the PE, lung lesions, or aorta measurements from the DICOM structured reports it receives and converts them to appropriate HL7 version 2 observation messages. This study is dictated using Voice2Docs, Abadox's radiologist reporting platform. Voice2Docs offers personalized, flexible workflows that integrate real-time results from AI systems to automate report creation and minimize clicks. The template has embedded smart fields which populate the measurements and details from Siemens into Voice2Docs. Because the AI results are coded in the RADLEX lexicon and other coding systems, the AI results are easily and automatically populated into the report template. Again, none of these measurements or observations were dictated by the interpreting radiologist. All that's left is reviewing and signing the report, which will hopefully improve a radiologist's efficiency and productivity. Now, this report looks different from what you're used to seeing back home. It follows the interactive multimedia reporting profile from IHE. Those reviewing the report can click on the series and image numbers for certain findings to navigate to representative images showing the finding in question.
Remember our thyroid nodule from before? Now we need follow-up. Through Abadox, the patient has been scheduled for outpatient ultrasound about a week after discharge. At the appointment, an ultrasound technologist acquires images of the thyroid. The images are again sent to Visage PACS. In this case, the Kios algorithm queries the PACS and analyzes the thyroid ultrasound images. Kios results are viewed within the Kios application, launched directly from PACS. Kios DS Thyroid detects the following: location, size, composition, echogenicity, and presence of echogenic foci. Importantly, it also assigns a TI-RADS category. Here we see a TI-RADS category of 5 assigned. The radiologist agrees and accepts findings. Subsequently, Laurel Bridge Compass extracts relevant findings on each nodule from a DICOM format AI result and pushes an HL7 report to Abadox. We'll once again launch Voice2Docs and select our best match for the ultrasound thyroid. As you can see, the results from Kios AI interpretation are already in the report template. As we scroll down in the report, we see that the impression has also been provided by Kios to identify the TI-RADS scoring and billing CPT. As you know, the American College of Radiology Thyroid Imaging Reporting and Data System, TI-RADS, provides management guidelines for nodules that are discovered incidentally on ultrasound, including a standardized risk stratification system based on the TI-RADS lexicon to inform practitioners about which nodules warrant biopsy. The 0690T Quantitative Ultrasound Tissue Classification CPT3 code provides a novel method of recording a billing code for the use of Kios's AI analysis for breast and thyroid quantitative analysis, enabling participating payers to reimburse for the usage of Kios on suitable exams. However, we are not done yet. The ultrasound findings definitely require follow-up. This is where Abadox's follow-up tracker comes into play. Abadox is a healthcare software provider specializing in radiology workflow solutions. Their activity tracking is worklist-driven, so centers can easily manage their patient follow-ups. From this window, we can log on our most recent attempts to contact the patient and view our prior attempts. We can also send messages directly to the patient via the patient portal or SMS. We'll show you the text interactions right now. The tracker is used to schedule the patient's outpatient return for the thyroid ultrasound and future follow-up for pulmonary nodules and ascending aortic aneurysm. You may have noticed that all of these different applications, including the PACS, image viewers, and reporting, open correctly to the same patient. This is possible using Firecast. Firecast is not the same thing as Fire. Firecast coordinates applications to look at the same patient securely. Firecast, in short, is a standard that synchronizes clinical applications, EHR, PACS, reporting systems, AI tools, to a given study or patient. Upcoming versions of Firecast will also enable exchange of measurements and AI findings. You have also seen how the Laurel Bridge Compass Workflow Manager serves as the AI orchestrator by connecting modalities, PACS, 3 different AI models, AI viewers, and reporting systems. In our example scenario, Compass routed studies and reports intelligently to the appropriate destinations. It was also able to ensure interoperability by converting results from DICOM to HL7. This was done following various industry standards, including the IHE AI Trial Implementation Standards that were mentioned earlier in the introduction. You may notice a similar role for the Cuvera interface engine on the other demos, which acts as a translator between different standards such as DICOM, HL7, and FHIR. For example, Cuvera can convert DICOM SR results into FHIR, so the data is understood in both the PACS and EMR. It could also be used as an AI label for future AI algorithm development. In conclusion, we hope that you consider the following takeaways. The architecture of the overall system for your hospital is critical, requiring international standards such as IHE, DICOM, HL7, and FHIR enables interoperability. Requiring structured, coded semantic systems such as RADLEX, LOINC, and SNOMED will make the AI and other data flow through the system. Some benefits shown in this demo include how AI models can improve our workflow from image interpretation to report dictation, and how AI models can help you interact with patients and ensure appropriate follow-up. Thank you for watching this demonstration. There are 2 other imaging AI and practice imaging workflow demonstrations using other clinical scenarios with other products. Consider watching all 3.